The cheese in your refrigerator might be doing more than adding flavor to your sandwich. It could be quietly nudging up your blood pressure, upsetting your digestion, and even interfering with medications you take. If you're over 60, a few common cheese choices deserve a hard pass. I'm Dr. Emily Carter. I work with older adults every week, and I've watched otherwise careful people, those who exercise, who take their pills on time, who try to eat vegetables, still struggle with stubborn high blood pressure, swollen ankles, unexplained fatigue, and weaker bones. Often the cause isn't dramatic, it's small, repeated choices. The cheese you reach for because it's easy, colorful, or already shredded for you. Today I'll walk you through 4 categories of cheese I recommend seniors avoid, and why they're risky. I'll also preview 4 traditional aged cheeses that can safely be part of a daily habit to support bones, muscles, digestion, and heart health. We'll keep this practical, what to look for in the store, how to prepare it at home, and a simple serving idea you can try this week. If this matters to someone you love, tap like so they can find it. Let's start with the cheeses that are most likely to cause trouble. The first one is almost everywhere, those bright orange, individually wrapped processed cheese slices. They're convenient, they melt predictably, and they've been a staple of quick lunches for decades. But what you're reaching for is often less cheese in the traditional sense, and more a food engineered for shelf stability and convenience. To get that uniform melt and long life, manufacturers add emulsifiers and stabilizers, ingredients like sodium phosphates and other salts that keep the oils and proteins from separating. Those same additives increase the product's sodium load and alter how fats are structured. The result is a sandwich topper that can deliver a surprisingly large dose of salt and industrial fats in 2 thin slices. Why does this matter more as we age? First, older adults tend to be more sensitive to sodium. Blood vessels stiffen with time, and extra sodium makes the body hold on to fluid and can raise blood pressure. If you're managing hypertension or kidney disease, that daily slice or 2 can add dozens, sometimes hundreds, of milligrams of sodium before you add anything else. Second, some of the processing techniques used in these slices have been linked to unfavorable changes in blood lipids and low-level inflammation in animal and lab studies. That inflammation affects the lining of arteries and the gut microbiome, 2 systems already more fragile with age. Finally, these products often hide other additives and artificial colorings that do little nutritionally. They're there for appearance and texture, not for health. A practical swap. Choose a small wedge of real cheese and slice what you need. If melted cheese on a burger or over vegetables is the goal, a thin piece of aged cheddar or Swiss will melt nicely and give you real dairy nutrition without the long ingredient list. The takeaway: when convenience is the reason you pick something, read the label and favor minimal ingredients. Next are the shelf-stable cheese spreads in jars and tubs that sit on pantries and party trays. These products promise long life at room temperature, which sounds handy, but that shelf stability is achieved through a combination of refined oils, texturizers, and preservatives that shift the product away from genuine cheese. To create a spreadable texture without refrigeration for weeks, manufacturers commonly use emulsified vegetable oils, hydrogenated or intraesterified fats in some formulations, and flavor enhancers that mimic dairy richness. Packaged in shiny tubs or jars, they can look harmless, but they are, in many cases, processed blends that prioritize spreadability and cost over nutrient quality. For seniors, the concerns are multi-layered. Highly processed spreads can be higher in unhealthy fats that promote inflammation, and that inflammation is a root factor in a range of age-related conditions: stiffer arteries, joint pain, and metabolic strain. Some spreads rely on flavor enhancers that act like concentrated sodium and glutamate. They make you crave more, increasing overall salt intake. The packaging itself matters too. Certain types of plastic and sealing agents can leach trace chemicals, especially if the product sits on a warm shelf. While the levels may be low, older bodies tend to have a decreased capacity to detoxify and repair, so cumulative exposures matter more. If you like something creamy on crackers or toast, reach for real, soft cheeses from the refrigerated case. Small amounts of ricotta, fresh chèvre, or plain yogurt-based spreads made from real dairy. They won't last weeks unrefrigerated, but they offer the textures you want with fewer questionable ingredients. In short, long shelf life at room temperature is often a red flag for products built with industrial shortcuts rather than food you'd make in a kitchen. Moving on to a banana skin, many of us overlook pre-shredded cheese in plastic bags. It's marketed as a time saver, no grater, no mess, but the convenience comes with trade-offs you rarely see listed on the label. To keep shredded cheese from clumping in the bag, anti-caking agents like cellulose or modified starches are added. That keeps the shreds separate but also coats the surface, changing how the cheese behaves in your mouth and in your gut. Many pre-shredded bags also carry a thin coating of natamycin or other surface anti-mold agents to prevent visible mold in the package. That's useful for shelf life, but it changes the microbial environment on the cheese surface. The processing that goes into shredding and packaging increases the cheese's exposed surface area, which accelerates oxidation and can raise histamine levels as the proteins break down faster. For the average person, that may be a minor annoyance, but for seniors who already have more sensitive digestion or a history of histamine reactions, it can mean more bloating, headaches, or flushing. There's also a slightly higher contamination risk with pre-shredded products simply because of the handling and processing steps. Once the protective rind is cut and the cheese is shredded into many pieces, more of it is exposed to air and handling. A simple habit change fixes this. Buy the block and grate it yourself. Freshly grated cheese melts better, retains flavor, and typically contains fewer additives. If grating is physically difficult because of arthritis, ask the deli to grate it fresh for you, or choose pre-shredded options labeled "no anti-caking agents" if available. The small effort pays off in taste and in fewer processed ingredients. Now let's talk about blue cheese. It's one of those gourmet items that divides people. Some love the punchy tang, others avoid it altogether. Blue cheeses, where the name comes from the blue-green mold veining, are made with specific cultures of penicillium that give them distinctive flavors and textures. Those molds are part of the cheese's identity, and in traditional well-made blue cheeses, they are safe and contribute to fermentation. The point of caution here is not the mold per se, but the compounds that can build up in this category: tyramine and histamine, and in rare situations, mycotoxins. Tyramine forms as proteins break down during aging. Histamine behaves similarly. Both can provoke physiological responses, headaches, flushing, and in some cases, rapid increases in blood pressure in susceptible people. Why is this a senior-specific concern? Many older adults are taking medications that interact with tyramine. Most notably, certain older antidepressants, MAO inhibitors, and some drugs used in Parkinson's disease can make you far more sensitive to tyramine's blood pressure-raising effects. Even without medication interactions, seniors sometimes have less efficient systems for clearing histamine and related compounds, making reactions more likely. Blue cheese also tends to be higher in sodium versus some other aged cheeses, which adds another factor for people watching blood pressure. I want to be careful with how I say this. I'm not condemning blue cheese for everyone. For many people, a small crumble is a delightful flavor experience and may be perfectly tolerated. For seniors, especially those on interacting medications with labile blood pressure or with known histamine sensitivities, it's a cheese category to approach cautiously. If a medication you take lists dietary restrictions, or you've experienced blood pressure spikes or severe headaches after aged foods, check with the prescriber or pharmacist before making blue cheese a regular habit. A short takeaway for blue cheese. Treat it as an occasional indulgence rather than a daily staple, and consult your clinician if you're on medications that might interact with tyramine. Across these four worst categories, processed slices, shelf-stable spreads, pre-shredded bags and blue cheese, there are common threads. Many convenience-focused products rely on additives, extended shelf lives, and manufacturing tricks that increase sodium, introduce emulsifiers, and change fat structures. Those changes can raise blood pressure, shift the gut microbiome, and increase low-level inflammation. For a younger, perfectly healthy adult, the occasional processed cheese may be a small hit. For someone over 60, with stiffer arteries, fragile kidney function, or multiple medications, those small hits add up in ways that matter. But before this feels like an extended list of do-nots, it's important to put the other side of the ledger on the table. Cheese is not a single thing. It's a family of foods made with many methods. Traditional aging and fermentation can create compounds that are beneficial, peptides that support muscle maintenance, forms of vitamin K2 that help direct calcium into bones rather than arteries, and fermentation byproducts that speak kindly to our gut bacteria. In the next section, I'll introduce 4 traditional aged cheeses that in small daily amounts can be part of a strategy to preserve bone density, support muscle, and keep digestion steady. Before we switch gears, a few practical shopping and kitchen tips to protect your health right now. When you shop, reach for the refrigerated cheese counter rather than the center aisle tubs if you want lower processing options. Turn that pre-shredded bag over and scan the ingredient list. If it lists a long string of anti-caking agents and preservatives before the word cheese, consider it a processed product. For packaged slices, resist the bright orange convenience. Real cheeses usually have simple ingredient lists: milk, salt, enzymes, cultures. At home, store cheeses properly, cold, wrapped in wax or cheese paper when possible, and not in plastic wrap for days on end. And if you're preparing food for someone who takes many medications or who has high blood pressure, choose cheeses with modest sodium and flavor blocks that you can portion precisely. These small steps protect you from the everyday cumulative effects I see in clinic: creeping blood pressure, gradual loss of strength, digestive symptoms that are easy to dismiss as just aging. The good news is that small swaps, trading processed slices for a small portion of traditionally aged cheese a few times per week, can be done quickly and with immediate benefits in taste and satisfaction. Now, just as I promised at the start, I'll begin to pivot from what to avoid toward what to include. The cheeses I'll recommend are not miracles, and they should be part of a balanced eating pattern, but they carry nutritional features worth noticing for seniors. Concentrated protein, highly bioavailable calcium, fermentation-derived compounds that may favor gut health, and forms of vitamin K2 that help place calcium into bone. I'll show you how roughly an ounce a day, about the size of 2 dice, can be a practical, enjoyable part of your meals without piling on salt or saturated fat. I'll also give specific shopping and pairing ideas so you can taste these cheeses in ways that amplify their benefits. Pairing an aged wedge with fiber-rich fruits and vegetables to improve digestion and slow absorption, or combining a small chunk with whole grains and greens to help with muscle maintenance after exercise. Understanding the why makes it easier to stick to the how. But before we dive into the recommended cheeses, let's pause on a few clinical caveats that often get missed. First, sodium remains the single most common overlooked nutrient in older adults' diets, and cheese is a stealth source. Natural aged cheeses vary widely. Some are lowish in sodium, some are naturally salty, and many packed pre-processed items are the worst offenders. If you have heart failure, chronic kidney disease, or uncontrolled hypertension, your tolerance for extra sodium is lower. Consult with your clinician about your personal sodium target. Second, medication interactions are not theoretical. Tyramine-sensitive medications are less common than in decades past, but they still exist, and the consequence, sudden spikes in blood pressure, can be dangerous. If any of your prescriptions carry dietary warnings, make sure to get specific guidance before making a cheese a daily habit. Third, portion matters. Even the best aged cheeses are concentrated. A single ounce gives a lot of nutrients. Multiple ounces daily can increase saturated fat and sodium intake quickly. The balance that helps seniors is small, consistent portions, not large daily platters. Finally, how cheese is produced matters. Artisanal or traditional aging tends to preserve beneficial fermentation products. Industrial processing that strips, emulsifies and repackages often strips beneficial microbes and replaces them with additives. With those guardrails set, in the next segment I'll introduce the first two cheeses I encourage seniors to keep in rotation and how to use them in simple, satisfying ways. First, let me introduce the first cheese I want you to keep on hand. Aged Gouda, the kind that has been matured at least 18 months. Imagine a firm wedge with a slightly crystalline texture and a warm caramel-like aroma when you crack it. This is not your grocery store young Gouda. This is a concentrated, savory wedge built by time and cultures. What makes it valuable for older adults isn't nostalgia. It's chemistry done right. During long aging, proteins break down into small peptides that are easier to digest and that act in subtle ways to support muscle maintenance and recovery. Aged Gouda is also one of the richer natural sources of vitamin K2, the form of vitamin K that researchers are looking at for guiding calcium into bones and away from soft tissues like arterial walls. That's not a magic bullet, but research suggests diets higher in K2 are associated with better bone density and lower markers of arterial calcification. For a practical senior, the benefits you'll notice are straightforward. A satisfying, savory bite that supplies a concentrated dose of protein and bioavailable minerals, often with far less lactose than fresh dairy. Because it's aged, the lactose content is low, so people who are mildly lactose intolerant often tolerate a small piece just fine. My recommendation: aim for roughly 1 ounce a day, about the size of 2 dice or a thumb-sized wedge. Eat it at room temperature for maximum flavor. Pair it with a fiber-rich accompaniment, a slice of whole-grain bread, a few apple slices, or a handful of roasted chickpeas. That fiber pairing helps slow carbohydrate absorption, supports gut bacteria with a steady food source, and keeps your blood sugar and digestion steady. Shopping tip: look for wording that indicates age, 18 months or older, and a short ingredient list: milk, salt, cultures, and enzymes. If the label reads like a chemistry set, put it back. Storage tip: wrap in cheese paper or wax paper and then a loose layer of foil. Keep it in the coldest part of your fridge, not in a plastic container that traps moisture. If grating is hard on your hands, buy a modest wedge and ask the deli to pre-slice or pre-grate small portions for you. A little Gouda goes a long way in flavor and nutrition. Next on the list is Parmigiano Reggiano, the classic hard Italian cheese that many of us know as Parmesan. But I'm talking about the traditionally aged product with that protected naming. This cheese has been aged 24 to 36 months or more, and the aging process concentrates protein and minerals into a very bioavailable form. 1 ounce of true Parmigiano delivers a notable amount of high-quality protein, useful for preserving muscle mass, especially when combined with light resistance activity like standing exercises or a short walk. Aging breaks proteins into peptides that the body can use more readily for repair and neurotransmitter support. People often report improved satiety and even a small lift in mood when they include a modest amount in meals, likely because of its flavor and the amino acid content. Practical uses are everywhere. Grate a small amount over steamed greens, roasted vegetables, or a small bowl of whole-grain pasta with olive oil and lemon. That sprinkling enhances flavor, so you can use less salt overall. A big win if sodium is a concern. Portion-wise, 1 ounce a day is plenty. A chunk of Parmigiano will keep for weeks in the refrigerator if wrapped properly. And because it's so flavorful, you'll find a little goes a long way. Good news for both taste and your grocery bill. A few extra pointers. Because it's concentrated, Parmigiano is relatively high in sodium compared with some mild cheeses. So if you have strict sodium limits, follow your clinician's guidance and use smaller portions or less frequent servings. If you take blood thinners or other medications that are sensitive to changes in vitamin K intake, check with your provider before making any new daily habit. This is always a quick phone call that keeps you safe. Third is Pecorino Romano, the traditional sheep's milk cheese that has been aged to a crumbly, sharp finish. Sheep's milk has a slightly different nutrient profile than cow's milk. It tends to be richer in certain minerals such as zinc and selenium and can provide peptides that support muscle repair. For seniors working to preserve lean mass, that mineral density matters. Pecorino brings strong, savory flavor, which is helpful because one small amount can contribute big taste without needing to add extra butter or salt elsewhere on the plate. Because pecorino is naturally saltier, I emphasize portion control. 3/4 to 1 ounce is a smart serving size. Pair it with potassium-rich foods, roasted tomatoes, steamed spinach, or a citrusy salad, so that the sodium load is balanced within the meal. If you rely on a low-sodium plan for heart or kidney disease, discuss pecorino's place in your diet with your clinician and consider using it less frequently or in smaller amounts. For people who enjoy bold flavors, mixing a small crumble of pecorino into a bean salad or over winter greens can provide satisfaction without excess volume of food. Shopping tip: pick the aged, hard pecorino rather than softer table spreads. The aging is the beneficial part. Grate a small amount fresh onto dishes or have your grocery deli help portion it out into 1 ounce packs for easy use. And if you're watching sodium, look for complementary sides, cucumber, lettuce, avocado, that add potassium and fiber. The fourth cheese I recommend as an everyday gentle option is Emmental, often called Swiss, made in the traditional way with distinct eyes, those holes, and a mild, nutty flavor. Emmental is a useful daily cheese because it tends to be on the gentler side in terms of sodium when compared to more heavily salted aged cheeses, and its texture is forgiving for people with dental concerns when melted or thinly sliced. The fermentation process in Emmental produces friendly compounds, mild postbiotics, that can support gut bacteria and help with digestion for some people. It is also an accessible cheese for everyday sandwiches, melts, and snacks. Practical ideas: a 1 ounce slice of Emmental with whole grain crackers, a slice of tomato, and a bit of fresh basil makes a satisfying snack. Melt a small amount over steamed vegetables or an open-faced sandwich to make chewing easier. If you're concerned about sodium, choose the least processed variety you can find. Again, short ingredient lists are your friend. A few cross-cutting examples of how to use these cheeses in realistic daily life. Start the day with a savory breakfast that includes a small handful of chopped Emmental melted into an omelette with spinach. At lunch, grate a tablespoon of Parmigiano over a hearty salad or bowl of lentils. In the afternoon, enjoy a thumb-sized piece of aged Gouda with a few apple slices and a small handful of walnuts, and dinner can include a light crumble of pecorino on top of roasted vegetables. These are small, repeatable swaps that add protein, flavor, and beneficial fermentation products without turning every meal into a cheese board. Now, some specific shopping and kitchen strategies to make these habits practical for seniors and caregivers. First, buy blocks or wedges rather than pre-sliced or pre-shredded packages. That limits exposure to anti-caking agents and surface preservatives, and it gives you control over portion sizes. If mobility or arthritis makes grating difficult, ask the deli or cheese counter to grate a small bag for you. Or buy a simple, ergonomically designed rotary grater that's easier on the hands than a flat box grater. Second, pre-portion into 1-ounce servings and store them ready to grab. Use small, resealable bags or reusable containers labeled with the date. This both controls portions and reduces temptation to overserve. Third, preserve quality and flavor by keeping cheeses wrapped in breathable paper or wax paper in a dedicated cheese drawer or container. Avoid long-term storage in plastic wrap, which tends to trap moisture and dull flavor. If budget or waste is a concern, remember that a little goes a long way. Buy a modest wedge rather than a large block. Because aged cheeses are intense, even small amounts will satisfy. Hard cheeses can be frozen in grated form for cooking. Freezing changes texture, but is useful for saving money on bigger purchases. If you choose to freeze, grate first and use frozen cheese for melting into cooked dishes rather than for fresh snacking. For people who have dentures or chewing difficulties, melting or grating makes these cheeses much easier to eat. A small grating of Parmigiano over soft-cooked lentils or a scoop of mashed sweet potato adds taste and nutrition without creating chewing challenges. For people with mild lactose intolerance, aged cheeses are often tolerated because the aging process reduces lactose. Start with tiny amounts and see how you feel. Let's address a few safety questions I hear a lot. If you take blood pressure medications, ACE inhibitors, diuretics, or have heart failure, the single most important nutrient in cheese to monitor is sodium. Many of the processed products we covered earlier are stealth sources of sodium. Switching to a modest portion of an aged cheese and using it to flavor meals can actually help you reduce overall salt. If you take medications that list dietary restrictions, particularly older antidepressants called MAO inhibitors or certain Parkinson's medications, tyramine is the compound of concern, and that's why I recommended being cautious with blue cheese earlier. Tyramine forms as proteins age and can cause abrupt blood pressure spikes in sensitive individuals. If you are on any medication where dietary tyramine is a named concern, speak with the prescriber or pharmacist before adding any aged or fermented foods that are high in tyramine as a daily habit. Another frequent question: what about vitamin K2 and blood thinners? Some aged cheeses contain K2, and while K2 behaves differently than the vitamin K1 found in leafy greens, any change in vitamin K intake can be relevant for people on warfarin or similar anticoagulants. Don't stop your medicines or change dosing. Instead, call your clinician and ask whether small, consistent amounts of certain cheeses fit into your regimen. Often the answer is yes, if the intake is steady and accounted for, but every case is unique. We also need to be realistic about sodium levels in natural cheeses. Not all aged cheeses are low in sodium. Pecorino, for example, is characteristically salty, so if you love its flavor, plan smaller portions and pairings that are low in sodium and high in potassium, steamed greens, beans, or fruit. Parmigiano is flavorful and allows you to use less overall salt in cooking, so it can be a net positive for many sodium-conscious eaters. Emmental often falls in a moderate sodium range and is versatile for daily use. The key is portion size and meal context. Not every cheese fits every meal, but with basic planning, you can use these cheeses to enhance nutrition without overdoing sodium. What about gut health and fermentation? The term postbiotics gets used a lot in recent years to describe the small molecules produced during fermentation that can affect local gut bacteria and immune signaling. Aged cheeses contain a spectrum of these compounds in low concentrations. For many older adults, that can translate into gentler digestion and better tolerance to dairy compared with unfermented dairy. We don't have conclusive human trials proving that eating a wedge of Gouda daily will transform your microbiome overnight. But research suggests fermented foods contribute to a diverse gut environment over time. And diversity matters for digestion, immunity, and even mood. In practice, here are simple, reliable meal patterns that incorporate these cheeses without excess calories or sodium. For breakfast, scramble 1 egg with a tablespoon of grated Parmigiano and a handful of spinach. Serve with a slice of whole grain toast. For lunch, make a salad with mixed greens, half a cup of cooked beans, a tablespoon of grated pecorino for flavor, and a drizzle of olive oil and lemon. For an afternoon snack, 1 ounce of aged Gouda with apple slices and a few almonds. For dinner, a small open-faced sandwich of whole grain bread, a thin slice of Emmental melted over roasted mushrooms and tomato. These are examples. Tailor them to your taste, mobility, and medical guidance. Caregivers and adult children. Practical things you can do to make these swaps stick. Pre-portion cheese into individual servings and place them in the fridge at eye level so they're convenient. Create a simple cheese board drawer with labeled containers for aged Gouda, Parmigiano, Pecorino, and Emmental. Small amounts that keep well and provide variety. If someone you care for is on multiple medications, keep a list of the medications and ask the pharmacist whether any interact with tyramine or vitamin K. This is a fast way to catch potential concerns before they become problems. When cooking for a group, use a very small amount of a strong cheese for flavor instead of heavier spreads or processed cheese. Your guests will still taste richness, and you'll reduce sodium and additives for your loved one. A few troubleshooting notes. If you try an aged cheese and notice headaches, flushing, or palpitations, stop and take note. Those are signals to check for histamine or tyramine sensitivity and to discuss with your clinician. If you have bloating or increased gas after switching to aged cheeses, try reducing the amount first and see whether a gradual reintroduction is tolerated. Sometimes a slow ramp lets gut bacteria adjust. If your clinician recommends strict low sodium limits, look for less salty aged cheeses or use very small quantities spread across meals rather than a single large portion. Let me return to the why this matters frame. Aging changes the body's ability to handle cumulative exposures and to repair low-level damage. Tiny, repeated stresses, extra sodium, low-quality fats, emulsifiers, processed preservatives, add up. Conversely, small, consistent positive choices, an ounce of traditional aged cheese a day, fresh vegetables, a bit of daily movement, also add up. The difference is that those positive choices can be just as small and just as doable as the less helpful ones. Over months and years, choosing a real aged wedge over a processed slice several times a week can mean measurable improvements in blood pressure control, in how full you feel after meals, and in maintaining muscle mass and bone support. Before I close, a quick checklist you can take to the store today. 1. Avoid brightly colored, individually wrapped slices and center aisle shelf-stable tubs labeled as spread if your goal is nutrition for long-term health. 2. Pick blocks or wedges from the refrigerated counter. Gouda, aged 18 months or more. Parmigiano Reggiano, aged 24 months or longer. Aged Pecorino, rather than fresh sheep's milk spread. And traditional Emmental. 3. Check labels. The shorter the ingredient list, the better. 4. Pre-portion into 1 ounce servings and pair with fiber and potassium-rich foods. 5. If you take blood pressure medications, MAO inhibitors, Parkinson's drugs, or anticoagulants, call your clinician or pharmacist to confirm there are no reasons to avoid a particular cheese. These 5 small steps will get you most of the way towards safer, smarter cheese habits. To summarize in plain terms, there are 4 categories I advise seniors to avoid or limit: processed slices, shelf-stable spreads, pre-shredded bags with anti-caking agents, and frequent use of blue cheese for people on tyramine-sensitive meds. And there are 4 traditional aged cheeses worth keeping in rotation: aged Gouda, Parmigiano Reggiano, Pecorino Romano, in moderation because of salt, and Emmental. Small, regular portions, around 1 ounce daily, can contribute protein, bone-supporting vitamin K2, bioavailable calcium, and fermentation-derived compounds that favor digestion and muscle maintenance. These cheeses are tools, not cures. They work best as part of an overall healthy pattern that includes movement, fruits and vegetables, whole grains, and attention to medications and medical conditions. If you take one action from this video, make it this. Next time you're shopping, pick up a small wedge of one traditional aged cheese and plan to have it in a simple pairing that week. Try aged Gouda with apple slices, Parmigiano over roasted broccoli, Pecorino in a bean salad, or Emmental melted on whole grain toast. Taste matters. If it doesn't feel enjoyable, you won't keep it up. Choose what you like, keep it modest, and be consistent. If this video helped you think differently about what's in your fridge, subscribe for weekly evidence-based tips on staying strong, mobile, and independent. Leave a comment below. Which cheese will you remove from your kitchen, and which aged cheese will you try this week? I read your comments and I'll respond with practical ideas. I'm Dr. Emily Carter. Stay curious, stay safe, and take care of the small daily choices that add up to big health over time.